Welcome to the VCU School of Medicine's Minutes of Time, Teaching in Medical Education podcast series. This series is produced by Faculty Development in the Office of Faculty Affairs and features discussions with innovative medical educators about best practices in teaching, learning, and scholarship. If you know a preclinical or clinical faculty member that is making a significant impact on student learning or research, let us know by leaving us feedback on our website at go.vcu.edu/iteach. We'd love to share their story. Today we are talking with Dr. Bennett Lee, who is a general internist and the director of the new Ambulatory Clerkship at the VCU School of Medicine. Many of our listeners may know Dr. Lee from the Gen Med podcast that featured him describing his engaging teaching methods using cases, word clouds, and a web-based audience response system to connect students in Richmond and Fairfax, Virginia. A graduate of the VCU Teaching in Medical Education Faculty Fellows Program, he is the quintessential representation of the innovative medical educator. But for those of you who may not be as familiar with Dr. Lee, let's take a few moments for him to tell us a little bit about himself and the Ambulatory Clerkship. Dr. Lee.
So I am a general internist in the Division of General Medicine here at VCU. The Ambulatory Clerkship is a core clerkship for all third-year medical students in the School of Medicine. Mm-hmm. It was developed last year, de novo. It came about as the school realized and desired to have more ambulatory exposure for third-year medical students. Already in the curriculum, they had a lot of exposure to inpatient medicine. This was a way to help expose them to more outpatient care that was not necessarily specialty specific, but touched on areas, knowledge, skills, attitudes that were important for all ambulatory specialties.
Great. Now, one of the goals of this 4-week clerkship is to provide students an opportunity to contemplate issues related to interprofessional teamwork, critical decision-making, and patient care through an examination of what you call an Art of Medicine project. Tell me a little bit more about this and how it's transformed over the past couple of years.
The initial idea was to have the students, or give them an opportunity to reflect on their experiences during the 4 weeks of the ambulatory clerkship. So we asked them to post information about various critical incidents that they had during their 4-week clerkship. Initially, we had them do projects related to that where they could either do a poem or an essay or do artwork that related to their reflection on their patient encounters. As we were exploring different ways of allowing them to reflect on their patient encounters, specifically looking at how teamwork, communication, quality improvement, social determinants, how that all affected the patient encounters and their idea of what it was to be a physician, we decided to incorporate the use of the digital stories, which we first encountered during the Time Fellowship.
Excellent. So, digital storytelling. Tell me a little bit about what this is specifically, and how did you, again, become interested in it?
So, digital storytelling is a way in which the students can engage and think about their encounters using a variety of different media. So they're able to incorporate both images, their perhaps music or a soundtrack. They write a script describing their encounter, and they're able to listen to themselves or use their own voice in this particular media. Through the process of putting together these stories, the hope is that they're able to delve more deeply into their reflection on the incidents that they have. I first became interested in it through the Time Fellowship and the class with the good Professor Warren, and was exposed to that. You know, they can obviously use it as a way of reflection, sort of self-reflection. They can use it to analyze things or to promote ideas. But we use it as a way for them to reflect on things, and that's sort of how we used it as well in the class. And that's what was most attractive to me. It gave them a little bit of more of a framework on which to work on their reflection piece.
Mm-hmm. And many of these stories are short and efficient, so they're no more than 3 minutes.
Yes, we limit them to 3 minutes. We give them a script of about 300 to 350 words to work with. Part of this is to allow them to efficiently, so to speak, reflect and have them focus in on the areas that they're interested in. And I think that definitely helps, once again, give them a framework from which to work within.
Yeah. So what have the students said so far?
So it's been very interesting. What initially usually happens is there's a look of a little bit of fear,
Yeah.
a little bit of anxiety about putting together a project, especially for those who are less "quote unquote" tech savvy. Some students have already worked in using some digital stories in the past. Most of them are novices to this, though. The interesting thing is most of them, the biggest thing that a lot of people are concerned about is hearing their own voice, interestingly enough. But almost universally, by the time they're done with the project, even those who are maybe a little skeptical about why they were doing it have bought into the process and have become proponents and more engaged.
Interesting that some students find some trepidation when they listen to themselves. How important do you think that is with regards to the communication skills and the professionalism that students are comfortable with hearing themselves and how they may be perceived by their patients?
Yeah, I think it's a nice way for them to think about how they are communicating with patients. Really think about literally the sound of their own voice and how that comes across. Mm-hmm. I don't think we often do that enough in medical training. We talk a lot about, you should communicate with an open mind and ask open-ended questions, but the actual hearing of their own voice and how they are perceived, how they come across to others is often not really examined. And I think this gives them a way to have their peers comment on that, as well as a way for them to once again sort of reflect on how they are coming across.
Excellent, excellent. So you've piloted this project for about a year now. What have been some of the challenges and how have you addressed those, and what have you learned from this experience?
For us, the challenge has been a couple of things. One is the size and the number of learners that we have at any one time. This particular exercise it's helpful to have smaller groups where you can be perhaps in a more intimate setting.
Is it 8 to 10?
8 to 10, something like that is probably more ideal. Sometimes we flex up and have as many as 20, 24 students, which is okay. It becomes a little bit more challenging in a larger group, mostly because as the group gets larger, people are more reticent to respond or reflect or share their questions or concerns or their own stories sometimes during the group, debriefing portion of the exercise. I don't necessarily think it affects the actual stories. I think the stories themselves and the digital stories, I think they are, as poignant and as useful with a larger group as they are with a small group. It's more when we meet with them as a group at the end where we view everyone's stories together, it's often more times a little bit more challenging with a larger group.
To facilitate that conversation.
Correct, yeah. The facilitation of that becomes a little bit more difficult.
Interesting.
I will say the other interesting thing that we have is we do a teleconference with some of the students up at the Inova campus, and the digital stories themselves come across. We're able to have good conversations. It is perhaps a little more challenging when you have a large group down at one site and a smaller group at another. The facilitator, we definitely have to be mindful of making sure we engage, the folks at the remote site more so than we would if we were just obviously by ourselves.
Typically, a digital story is framed as a way to catalyze a conversation. It's also an individual project that someone can take on. It sounds like a lot of the student learning is occurring through the individual projects. But at times, because there's so many people, that conversation has so many voices and so little time. Is that what I'm hearing?
Yeah, to a certain extent. I think, the individuals, I think, get a lot out of it. There is, once again, a little bit of a challenge to make sure that all the different perspectives are heard when you're in a larger group. In some ways, you're able to bring out those questions or bring out those different views better when you have a smaller, more intimate group. But we're still able to do it. It's just a little bit more challenging.
So I'm sure that many of these personal narratives are very subjective. How do you evaluate or grade them?
One of the ways we sort of evaluate the digital stories themselves is we have a rubric where we lay out, what we think a successful digital story is, whether it be how they use their images, the pacing of their voice, some of the technical aspects, how clear are the images, is the sound of the soundtrack too loud or not loud enough. Also, through our discussions, we actually talk about the content of the stories. And is there a problem that's addressed? How is it presented? Although, we don't necessarily, quote, grade the digital stories themselves, we do provide a way for them to get some feedback on the success of the story, so to speak.
And to ensure that the students participate.
Correct, yeah. So they do have to participate. They do have to have completed the story. They do have to have shown that they've been thoughtful in their reflection. And, for the most part, students have been very thoughtful in their execution of the projects.
Excellent, excellent. Now, are there any other specialties or area of medicine and medical education that might benefit from digital storytelling when it's used as a signature pedagogy?
I think that any time where there is a controversial or perhaps difficult area in which we engage the students, if we're talking about end-of-life discussions, for example, or communication, or when there's a medical error, things like that, things that can really shape a trainee's view of what it means to be a physician. I think using things like digital stories can be very useful in that it, once again, it makes them reflect about what it means to them to be a physician. It makes them think about what are the difficult areas in having things like hard discussions about medical errors or end-of-life discussions. So I think in those sort of areas where you're not necessarily teaching the data that goes along with some of the pieces of medicine, where you're talking a little bit more about communication, perhaps even feelings, I think in those areas is where digital stories can really help.
Excellent, excellent. And now for faculty that are interested in integrating digital storytelling in their practice, where do you recommend that they begin?
That's a good question. I think that obviously they have to look at what they think their goals are for their particular area. So, whether it be a clinical rotation or something that's in the more basic science realm, or what is our goal for that particular project? If for us, once again, it was a thought of how do you reflect upon your idea of what it means to be a physician in taking into account some of these things such as teamwork and communication, etc. I could foresee where you could use digital stories to help as they think about how to analyze a particular area of medicine or how to explain a certain area, whether it be, like physiology or the biochemistry of something. You might be able to use that as a way of helping them learn the material and sort of present that in a way. So I think, whoever ends up using this should, obviously there are examples out there of digital stories, and to get a sense of what it all means to do a digital story and what are the benefits. It's something where I think you have to view it and see it, get an understanding of what it might be able to do for you.
Excellent. Thank you so much, Dr. Lee. We appreciate your time.
You're most welcome.